If you are over the age of 60 and your legs frequently feel cold, heavy, or plagued by painful cramps, you have probably tried just about everything to find relief. Maybe you've tried walking more, elevating your feet at the end of a long day, wearing thicker wool socks, or even paying for professional massages. Yet, despite your best efforts, nothing seems to really work. The heaviness returns, the coldness persists, and the frustration grows. As a surgeon with over 30 years of clinical practice, I am here to tell you why those methods often fail. It is because you are missing the one thing that actually moves blood through your legs effectively. Most people assume the heart is solely responsible for circulation, but when it comes to your lower extremities, that isn't the whole story. It isn't just your heart, and it isn't just gravity. There is a hidden pump located deep inside your calves that most people have never even heard of. In my 3 decades of operating, I've seen that this secondary pump is often the literal difference between patients who maintain their mobility well into their 80s and 90s and those who tragically lose it. The good news? Activating this pump takes only 5 minutes. You can do it while sitting comfortably in a chair, and the results can begin to manifest within just a few days. Today, I am going to show you exactly how to jumpstart your circulation. Before we dive into the exercise, you must understand the highway system inside your body. Your heart is the engine, pumping oxygen-rich blood out through your arteries to every single cell. Once that oxygen is delivered, your veins have the difficult job of carrying that blood back up to the heart. This is where physics becomes your enemy. Blood flows down to your legs very easily because gravity is helping it along. However, returning that blood upward from your feet back to your chest is a massive challenge. It is a 4-foot vertical climb against the relentless force of gravity. Your heart alone simply cannot generate enough pressure to finish the job. The distance is too far, and the pressure gradient isn't strong enough. Because of this, the human body evolved a brilliant backup system, a secondary pump built directly into your calf muscles. When these muscles contract properly, they squeeze the veins, acting like a manual bellows that pushes blood upward. If those muscles are weak, or if you aren't engaging them correctly, the blood pools in your ankles and feet. This pooling is what causes the coldness, the heaviness, and the crampy sensations you're feeling.
The exercise I prescribe most frequently for circulation issues is called the calf pump raise. I want to be very clear, this is not a regular calf raise like you see athletes doing in the gym. While regular calf raises are great for building muscle mass, they're often done too quickly to help with venous return. For circulation, you need what I call maximum venous compression with sustained contractions. You need a specific technique designed to maximize blood flow. I'm going to teach you 2 versions, the seated version and the standing version. The seated version, perfect for beginners. If you struggle with balance or are just starting out, start here. The position. Sit upright in a sturdy chair. Keep your feet flat on the floor, hip-width apart. The lift. Slowly raise both heels off the ground, pushing through the balls of your feet. Rise as high as is comfortable for you. The squeeze, the secret sauce. At the top of the movement, squeeze your calf muscles hard, really contract them. Hold this squeeze for 3 full seconds. Imagine you are trying to wring water out of a soaked sponge inside your lower legs. This squeeze compresses the veins and forces the blood upward toward your heart. The descent. Slowly lower your heels back down. Take a full 3 seconds to descend in a controlled manner. Do not just drop your heels. The tension. Before your heels completely touch the floor, begin the next repetition. This maintains continuous tension on the pump. Do 15 repetitions, rest for 30 seconds, and complete 3 total sets. The standing version, for maximum range. Once you feel steady, the standing version provides even better results because it allows for a greater range of motion. The position. Stand behind a sturdy chair or at a kitchen counter for balance. The movement. Rise onto the balls of your feet, lifting your heels as high as possible. The hold. Squeeze those calf muscles firmly at the very top for 3 full seconds. The control. Lower yourself slowly over 3 seconds, and just like the seated version, begin the next rep before your heels hit the ground. Again, do 15 repetitions for 3 sets. Whether you choose seated or standing, consistency matters far more than intensity. How often you do this is actually more important than how hard you do it. Blood doesn't stay pumped upward permanently. Gravity is constantly trying to pull it back down to your toes. To counteract this continuous pooling, I recommend performing your calf pump raises 3 times daily, once in the morning, once in the afternoon, and once in the evening. Think of it like priming a well pump. If you only pump it once in the morning, the water sinks back down by noon. By doing 3 short 5-minute sessions, you keep the blood flowing efficiently all day long. This is especially important after long periods of sitting. If you've been watching television for an hour or sitting at a desk, that is the perfect time to do a set. Once you have mastered the basic version, usually after about 2 weeks, you can move on to progressions. The single leg version, perform the movement 1 leg at a time. This doubles the load on each calf and forces a deeper contraction. The elevated surface, stand on a thick book or the edge of a stair while holding a railing. Let your heels drop below toe level at the bottom. This increases the range of motion substantially, leading to a more effective pump. Extended holds, instead of holding for 3 seconds, try 5 or even 10 seconds. Longer holds maintain the compression on the veins for longer periods, pushing the blood more thoroughly.
While the calf pump raise is a powerhouse on its own, you can multiply your results by combining it with these simple habits. Elevate your legs. Spend 15 to 20 minutes a day with your legs above heart level. Let gravity assist the blood return for a change. Stay hydrated. Dehydration actually thickens your blood. Thicker blood flows like molasses and is much harder to pump. Drink water consistently throughout the day. The 30-minute rule. Set a timer for every 30 minutes. When it goes off, stand up and do a quick set of calf pumps to prevent blood from pooling while you're sedentary. Compression socks. For many, external compression can assist the internal calf pump. Talk to your doctor to see if they are right for your specific vascular health. When you start this practice, here is a typical timeline of what my patients see. Week 1. You'll feel an increased awareness of your calf muscles and perhaps some mild fatigue. This is a good sign. It means the muscles are waking up. Week 2, you may notice your feet feel slightly warmer, especially when you're getting into bed at night. Week 3 to 4, many report reduced nighttime cramping and less tingling. You might even see your ankles looking less swollen. Month 2, significant improvement in endurance while walking and consistently warmer feet. However, I must be clear, this exercise supports circulation, but it does not replace medical treatment for serious conditions. If you experience worsening coldness, new skin discoloration, wounds that won't heal, or sudden severe leg pain, please seek immediate medical attention. These could be signs of a more serious vascular issue. Now you finally understand why the other things you've tried haven't provided lasting relief. Walking helps, but the range of motion in a normal stride is actually quite small. The calf only partially contracts. Elevating your feet is a temporary fix. The moment you stand up, the blood rushes right back down. Massage is manual, but once the hands stop moving, the blood stops moving. By performing calf pump raises, you are training your body to pump blood autonomously. You are strengthening the mechanism itself. This is about long-term health. Poor circulation can lead to infections, skin breakdown, and even blood clots. Thousands of seniors face interventions every year that could have been prevented by maintaining this hidden pump. You now know more about leg circulation than most people learn in a lifetime. Don't let this knowledge go to waste. You have a prescription now. 1 exercise, 5 minutes, 3 times daily. Let's start right now. Wherever you are, sit up straight. Lift those heels. Squeeze at the top. 1, 2, 3. Lower slowly. 1, 2, 3. That is your first rep. Do 14 more. You've just started your journey toward warmer, lighter, and healthier legs. Your legs have carried you for decades. Now it is time for you to take care of them. If you found this helpful, please hit the like button and share this with anyone over 60 who might be struggling in silence with cold or heavy legs. Let's help as many people as possible keep their mobility.